my name's Chloe and this is Emmerson, and Emmerson was born in Derby and I'm originally from Perth, but I've been living in Derby for over 10 years now. Emmerson was displaying some behavioural problems around 2.5, 3. We did notice in the wet season of the year before that she couldn't hear us. We'd call her, she wouldn't reply, but we didn't know if that was a behavioural thing or if it was an ear thing. And I decided to take her to DAHS because I thought maybe we needed to get some referrals for some specialists. We saw some paediatricians and they decided to do an auditory assessment, and in that assessment it was quite clear that Emmerson had hearing loss in both ears, and she was banded that very day, and we've been on the journey through grommets and hearing tests and ENTs ever since. I want to talk about the very beginning first, and it can make me quite emotional. When we saw the audiologist, she did the testing. She was very professional in her actual assessment, and then she said, "Oh, we always see Aboriginal kids here," and I was like, "Oh, Emmerson's Indigenous, you know," and she was like, "Oh yeah, but I mean real Aboriginal kids," and I was so offended, and I'm not even Indigenous. She gets her Indigenous background from her father. I just felt like that was, and I spoke to somebody who she also, this visiting audiologist, went to the hospital, and apparently she made exactly the same error again in another professional context in front of the allied health team, the speechies and the OTs. I said, that's just not good enough. You can't miss that working in an environment like Derby. So I just wanted to mention that just sticks with me. I can't shake that. So that was our beginning journey, and I thought, what are we in for if we're coming to Derby Aboriginal Health Centre and we're getting an attitude like that? When she was 4, it was tricky to get the teachers at school to figure out a plan for how to get her to put the hearing aid on, and we needed a bit more of a system to how we get it on and off and safe and things like that, and that was just a bit more of a practical hurdle. And now that she's a bit older, she can manage it herself. She definitely wears it during her literacy block in the morning, and for me that's really important because that's when she's getting there's exposure to all the sounds that she currently can't pronounce, can't say, can't hear in some instances. And we just make sure that we, like if she says she's got a sore ear, it's pretty obvious what is causing it, yeah. But they've also given us some activities like blowing up balloons to really keep those tubes clear, and I can't remember what the other one was. Blowing the nose, yeah, the very blow cough. But it was a relief to have, I suppose, an answer to why we're having meltdowns and extended periods of real turmoil for her. We didn't know really what avenue to go, so it was a little bit of a comfort, as well as, you know, we had a new journey, but it was a comfort to know that there was some help